Although fewer children have been seriously ill with COVID-19 compared to adults, there's still a risk of them becoming severely ill or developing severe COVID-19 complications, such as the multi-system inflammatory syndrome of children, MIS-C. Since mid-October 2021, we've observed several serious cases of COVID-19 in children, with some requiring intensive care. This is why it's important for children aged 5 to 11 to take up the COVID-19 vaccination. The Pfizer-BioNTech COVID-19 vaccination for children has been assessed by HSA and the EC19V, our own local expert committee, to be safe. The assessment is corroborated with international data. In the United States of America, where about 8.7 million doses had been administered to children as of the 19th of December 2021, most of the adverse events reported were not serious, and no safety concerns have been raised. 2.4% of the children experienced serious adverse events, such as fever, vomiting, myocarditis, and seizures. The incidence of myocarditis, which is what many parents are most concerned about, is about 1 in a million doses. The children reported with myocarditis following vaccination had either recovered or were recovering at the time of the report. Vaccination will allow our children to be protected against the disease and reduce the likelihood of infecting others, including the vulnerable and other family members, elderly family members. On the other hand, the incidence of myocarditis amongst individuals aged 12 to 17 infected with COVID-19 is about 45 per 100,000 infections. We assure parents and everyone that all our designated pediatric VCs are equipped with pediatric monitoring and resuscitation equipment. The medical personnel are trained to manage any on-site emergencies arising from allergic reactions. Most of the side effects experienced by children after the vaccination have been very mild: injection site pain, fatigue, fever, and they typically resolve within a few days. Members have asked if children are covered by VIFAB. The answer is yes, as long as they are Singapore citizens, permanent residents, or long-term pass holders. At present, only the Pfizer-BioNTech Comirnaty COVID-19 vaccine is authorized for use in children below 18 years. Special exemptions are made for those aged 12 to 17 who are not medically eligible for the Pfizer-BioNTech Comirnaty COVID-19 vaccine to receive the Sinovac-Coronavac vaccine under a dedicated public health program. MOH will work with the EC19V to review if the dedicated public health program should be extended to children aged 5 to 11 who are medically ineligible to complete the Pfizer-BioNTech Comirnaty COVID-19 vaccine based on further studies on the safety and effectiveness of the Sinovac-Coronavac vaccine.